I'll start. My name's Jonathan Gardiner and I'm delighted to be here to represent some minor aspect of the new Footscray Hospital. It's actually, there's a conference in the Footscray Hospital, let alone 20 minutes worth of cracking time between the three of us. I'd certainly like to start by acknowledging the land on which we stand and pay my respects to elders past and present. We did talk about it being a $1.5 billion hospital. There's many metrics on this stuff. My understanding is that by many measures, it's the largest public building undertaken in Victorian history. That's if you're above ground. Once you dig a hole for infrastructure tunnels, you buy a $1 billion printing machine and start turning the handle. But one of the things that our team did the very first day we met to start to think about this was, what a shame if you spend $1.5 billion and you end up answering the technical and functional brief. We've actually got great responsibilities to do more than that. And what $1.5 billion does give you is the capacity to work at scale. And it gives you capacity to deliver public health benefits, public realm benefits, public infrastructure benefits, and of course, public design benefits. And that all comes back to increased community and social capital that we can build in what really has been a neglected area of Melbourne's investment over a century. So this needs the whole team to work on that. And that's not just the bidding team, it's not the finance and structuring, the architects, the engineers. It's actually about engaging and partnering very directly with the Western Health organisation, who is a sponsor of the project, with the Department of Health's very sophisticated technical team. They did a terrific job with the technical and functional brief. Also the health professionals. And also, in addition, we spent a lot of time focused on a broader stakeholder group, which Clare will speak about in more detail. So what we've talked about really is the idea that there are a certain number of levers at our disposal to make this more than just a series of points of care or answering a technical and functional brief. The first lever really was interrogating the brief, extracting the public or the public-facing components of those, and looking at ways to configure them in a way that they can act invigoration and vitality to the public spaces and have meaning and connection between the people who use all the facilities in the hospital. The second technique that we used was a series of very personal, very detailed workshops where we worked live with our partnership team to bring it all together and to freely exchange ideas about how we can... I'll run through the slides as well. There's no great magic in the slides, if it's any comfort to you. But the idea of activating that, and it's not just about patient-centred health, it's actually about people-centred health at all times, because there's lots of people involved in the hospital. So if we do start to run through that, of course, the idea of being involved as a team, great experience, plenty of efficiencies that are available, and everyone's talked about the idea of design and build. We all know about how design and build. What a public-private partnership offers, of course, is the idea of adding finance and maintenance to that. And that provides a 25-year plus tail to the exercise that we're undertaking, and that, of course, provides the ability to do great quality work, but there's a tension between current costs and recurrent costs. And that tension is really healthy and helps develop a better result for the project. So what we did is we enabled a campus approach to the building to make sure it is part of the community. For those who don't know where the Footscray Hospital is, it's on a greenfield site quite close to the city. It is actually a fantastic site. On top of the hill overlooking the parklands and riverland session. And of course, if you do look carefully, you can see the final straight of the Melbourne Cup from half the rooms in it. Now, Melbourne has many scales. The most popular scale is how does it compare to the MCG. So we could host the MCG on the site when we started work, and a fair portion of the people who attended as well. So we looked at the idea that we're under a competitive design process. How do we make it meaningful for the people who will be using this thing? So the idea that there's a breakdown between how we can approach the site, the idea of a permeable site, one that has multiple entrances that are available for the public 24 hours a day. We started to look at the idea that there is actually a funding model that can help the quality of the positions that we put into the building that will last for the long term. We also spent a lot of time with our stakeholder groups making sure that we delivered what we promised. And so again, Clare will unpack this, but the idea that when we start to deliver images of the projects, it is in fact what we delivered. So here's one of our tendered renderings, and this is how it's actually coming out now. The project has actually been officially completed, I think, in that sense, on terms of the technical aspects, and it's now in the process of being bedded into open early next year. So there's a whole series of elements that we've put together. And the other thing we talked about is that we can provide, as it's a PPP process, more than just a technical brief. We can bring in other types of activity onto the site, and within weeks, Plenary was able to turn around business cases and make decisions on proceeding with alternative and additional elements of the project that added to the density and the vitality of the site. And Clare, again, will run through some of that stuff. We looked at the whole idea of scale. It's an enormous project, and so how do we make it people scaled? And so the idea of a folded ground plane that then moved into a podium level, highly activated edge, and up to a tower block that held the ward components of the project. There's certainly some pretty innovative funding that's come through there. The idea of making it a bigger project, enabling us to get better value per square metre of building footprint for the investment. And so the impact on the public purse is something that we can have a conversation about if required. And the idea that Cox has of designing more with less, and so it's a smart design. It's not a case of big is good, it's just that it's a certain scale. Therefore, let's take advantage of that scale. One of the things that we certainly looked at was the idea of integrating Indigenous thinking, conversations, and the idea that there was going to be some significant examples of how that can unfold. There's certainly a lot of work has gone into the Welcome to Country, Now You See Me, Seeing the Invisible, which we identified a location and went through a public process of bidding for the works, and we've built an absolutely beautiful piece of art that has taken 10,000 hours of weaving to come together. I'd like to thank the people who are involved in that. And again, some of the elements that have come together in terms of the idea that what we say we'll do, we do. And so here's some renderings. Here's some work under construction. The idea of a patient-centred ward that's about the people around the patient, not just a patient in a bed, and how that can be presented to the groups and then delivered as presented. And so you can start to get an idea here about how much additional work beyond the technical and functional brief was delivered on the site as part of this bid. Clare, I'd like it.
Thanks, everyone. I'm Clare Shiell, so I am Executive Director at Plenary, and so just a little bit about Plenary. So it's our 20th year of success, founded in 2004 in Melbourne, and we have a global reach, so across Asia Pacific, North America and the Middle East, and also in Central Europe as well, but obviously an Australian Melbourne-born company, and have a very big interest in healthcare in particular. And we've got a strong team. We're over 300 now, so it's grown significantly in the last, sort of 5 to 7 years in particular. And I think some of our assets that you'd be familiar with include, the iconic Victorian Comprehensive Cancer Centre in Melbourne, Casey, which was one of the very early sort of PPPs, and obviously the new Footscray Hospital. So with the new Footscray Hospital, as we've sort of established, it's Victoria's largest healthcare infrastructure development, and it's in the western suburb of Melbourne, which are absolutely booming. So this was a project that was, looking to increase the capacity from the existing Footscray Hospital, which is about 1 kilometre or so down the road. And for anyone who's visited the old Footscray Hospital, Western Health seems to do a lot of work, a lot of great work with very poor facilities. And so this was a real catalyst for change for them. It has about 200 odd points more of care and will enable about 20,000 more people to be seen by the emergency department alone. So about 15,000 more patients treated every year in the facility. And I think importantly what this PPP allows is a leading health, education and research precinct. And I think that is something which Western Health has certainly had an ambition for, and they've got dedicated Victorian University education and research building on site, this is in line with their ability to have a workforce training at Victoria University, as well as then obviously the research and the clinical practice that happens as well. And as has been mentioned, it's on track for completion later this year. So it is a partnership. There is, it's a public-private partnership, and there are various very best-in-class players that have come together to deliver on this project. So, Plenary Health is the consortium that's contracted to design and construct, finance and maintain the hospital, and it's over a really long term, over 25 years. And so with that, that brings a unique perspective in terms of the partners that it chooses to deliver these projects with. It really is best in class coming together to deliver something extraordinary. So, as with many PPPs, there are a variety of services that are provided, into the operating phase. And aside from the delivery of the actual construction, we have a long-term contract to deliver services, including non-clinical services, security, food, cleaning and the like. And soft and hard FM is also, part of that contract. So, in addition to that, though, there is a complementary suite of commercial buildings and opportunities that really add to the hospital's function. So, as with many PPPs, the actual clinical function will be delivered by Western Health, who is the operator of a range of existing health services, including the existing Footscray Hospital, a Sunshine Hospital, as well as a range of other services that it provides. And so this Footscray will actually be quite a hub for them in terms of staff and ICT as well. So, in terms of the why of public-private partnerships, I think, we can all understand the innovation that, people are striving for. And it's really not just about function. It really is about giving people, a really meaningful way in which they can engage with the healthcare sector. So we, as we said, bring together the most capable in the industry to solve these complex and challenging problems for government, and it's focused on real partnering. So whether that's with within the consortium themselves or with state and the operator, and it really is offering us stronger together rather than as individuals, as some other contracting models might have. And I think each is contributing to that long-term holistic approach to what is, a very, very complex community that will have to support over the long term. So whether it's the materials, the design, the way in which, patients flow through the hospital, all of that is considered in a long-term way. And I think, obviously, it unsurprisingly enables the health service to actually focus on what it does best, and that is providing clinical care to patients. So all of the hard and soft FM is provided by the private sector in support and in conjunction with the needs. And on this project, we specifically have a hospital integration manager, so someone who is there working with the hospital to make sure that the services that they're receiving and the interface with the asset is as optimal as it can be. So I think we've talked a little bit about the university and the opportunity for the campus to have some specific assets about that. And again, that's an amplification of the ambition that Western Health has about its interaction with the university and education sector. I think importantly though, as we've touched on earlier, the hospital is a community, And it was really a community at the heart of the design that we went through a process to engage with that community to really find out what's meaningful for it and what it wanted to see in the hospital. So it's often referred to as the People's Hospital. So the existing Footscray Hospital was funded by the community originally, and obviously has had immensely strong support, even though that community has changed significantly over time. It's a very multicultural community, and it continues to evolve and have different demands on its health service. So as you can appreciate, the gestation of these facilities is very long, and this started back in Master Planning and Business Case in 2017. And as you'd appreciate, the award of this and the commencement of this design process happened during COVID. So much of the early work of this was needing to be done online. And that's, sort of quite unique. And I think that's why the stories and the community, again, becomes a really central feature, and why we had to think, fairly, creatively about how we could engage with and we could value the time of those community members in giving their input into the design. So there are stories, around Mavis Mitchell, one of the first, matrons of the hospital, that will be represented throughout the hospital, whether it's, a naming of a cafe or an information plaque that features in some of the artwork that we've got curated around the hospital. Even things such as the, physical heritage bricks that represent the homes that, were on the original site, and so they are represented back into the hospital as an important reminder of the history that was before us. I think one of the things that we are really proud of is that the new Footscray Hospital is and will be a real catalyst for growth. So it's drawing on, that need for economic and urban renewal, and Plenary created a precinct which is best suited to meet those local aspirations for both, as we said, those health facilities and that broader urban renewal goal. So we know that this will be a landmark hospital, and it provides vital green space. It's in an area, and we'll see a couple of photos shortly, that you can see, whilst we've got the Footscray Park and the Flemington Racecourse in proximity, there really isn't a lot of active green space that can be used by the community in an easy to access way. And this will be a real asset that supports the revitalisation and growth of Footscray. So it does acknowledge the importance of a people's hospital. And I think part of that engagement was with our panel of stakeholders and community stakeholders, and they were really engaged to reform and refine what it was that we were trying to represent and respond to in the brief. So recent discussions with some of the panel members at one of our sneak peeks, as we know the hospital is very near to completion. So we've had some of these sneak peeks, and one of the panel members actually remarked about how represented that they felt in what they were seeing when they walked through the hospital. So they said, I remember talking about this, and there it is, and they were quite surprised about that linkage and that really, really strong connection to what it was that they gave the advice in the early phases of design. And I think touched on a little bit earlier, it was the permeability of the site. So it's central to its community, and you can see here how close it is to the residences of Footscray. We have the university across the road and some adjacency to Footscray Park as well. But the attraction of further investment into the area is really key. So the university's got plans for its redevelopment. A private hospital has been touted to, they've bought some land just across on Geelong Road, which is, within sort of 100 metres of the new precinct. And we've got, a range of commercial spaces that support the needs of the broader community as well as the staff and patients and visitors to the hospital. So as you can see here, it's a little bit crowded, but there is a lot of actual commercial spaces within the hospital itself, so whether they are retail cafes and the like, but we've also got GP clinics, imaging, pharmacy, and a gymnasium, childcare. So, a range of things that you would have in a little mini city. And they are there to support both the hospitals and the patients and the people that visit them to, make their lives easier, but also support the community more broadly. And so, this isn't just about, how can we maximise the commercial dollar. It's about putting meaningful response to what the community has said it is missing in its area. So some of the images here, these are under construction at the moment. So Cool Beans and Western Bulldogs have partnered together to provide a childcare centre, a really high quality childcare centre, which is very much needed. Footscray is one of those childcare deserts, and childcare for healthcare workers in particular, being close to their workplace is really important, and so that will be a great initiative, and they are already well and truly engaging with the community, but also mainly the staff, who we think will probably take up most of the spaces at the childcare centre. A gym, it seems simple, but having a gym that's accessible to both staff but also community, because there really isn't anything of high quality, and promoting the wellness aspect of that. There's a general store which has something as simple but is actually really difficult to arrange, Australia Post licences. So having somewhere where you can go and drop off your parcels, post mail and the like, that is a feature of these sort of general stores. Social Enterprise Cafe, again, just working with the community to, again, uplift. So it's not about, maximising commercial dollars in all of these aspects. It's about looking for what we can do and partnering with the community. So that Social Enterprise Cafe will work with disadvantaged youth to train them and provide them with a pathway for employment. And here you can see just how permeable the site is. You can see the entrance just off Tiernan Street, which is a walkable entrance. There's a similar one off Geelong Road with some often referred to as the Spanish Steps of Footscray, but we'll see if that sticks. But there is a real permeability and an invitation to community to come and enjoy the village green in particular. But the cafes along Tiernan Street, which is at the bottom of the slide, those cafes actually open out onto that street, and so will be open for everyone to enjoy. And so I think it'll be a really big uplift for that local community. And as you can see, the amazing Village Green, I think that's an opportunity for massive activation for both Western Health and Victoria University, and patients and carers have really commented when they've been able to have that sneak peek at the beautiful green space, and how that will contribute to just a feeling of openness and connected to nature. It's really an invitation and a hub for community to come together and have a special place, as well as get care that we know Western Health delivers absolutely in an amazing capacity.
Thanks, Claire. My name's Mark Mitchell, and I'm going to take you a little through a couple of journeys inside the hospital to see how it works once we get into the clinical spaces. A little bit of an orientation, and part of our strategy was that we actually didn't want to take up the whole site with hospitals, so there's really only 2 of the 5 buildings you consider to be hospital buildings, and we looked to try and break up the functions into a subacute building and an acute building with a number of pieces in between. Those other pieces, C, D and E, part of the strategy with the plenary team was thinking about the long term of the hospital, and so it could be renewed on site and could be there for much, much longer than sometimes hospitals can be. The previous hospital being moved off-site within 50 years. So the main orientation point from the main reception, our subacute is to the left and our acute is to the right, so that everything's quite close by, both sets of lifts, highly visible from the reception point. So this is looking towards that space between acute and subacute, and the idea was that, in fact, Waiting rooms didn't need to be in a clinical space, they could be in a public space. So the waiting rooms are infused with a coffee place, with wayfinding, and with the artwork that Jonathan was showing before. At that ground floor, within that subacute area, we have a wellness pod, which can be then switched across in pandemic mode so that it has a separate air conditioning system and a separate one-way flow through that facility, so it can be reworked to have a use beyond the original clinical purpose. And then we go up a second to the floor above to the allied health facilities, which form the second level of the ambulatory care setup. A few examples of then how we've taken the idea of community through the planning. We've always looked at try and get our circulation systems along the perimeter of the building, so you're following light and the space between the buildings as a way of accessing clinical spaces, through into the clinical spaces, in this example, the Allied Health Gym, and then through to green spaces, which are then coupled with those. So we have connections between inside and out, which is really the extension of the village green all the way up stacked through the building. A couple of other examples I'll just take you through briefly in terms of the subacute inpatient units and how we've approached this from a future-proofing perspective. I'll take you through in a moment, and the mental health inpatient units. And that similar journey from natural light and utilising those landscape spaces as clinical spaces, not just places to look at. So the journey into the mental health unit, arriving here to greeting spaces, through to staff spaces in the centre, through to indoor and outdoor program spaces, day spaces, and then off to our, the different pods that are accommodating high dependency and lower dependency patients, including an ability for gender separation, as well as separation into care profiles. This approach was also taken through our inpatient units, and we took each of the health facility guideline components and then looked at what we could do that was a little bit more geared towards the future, given we've got a 25-year plan for the building. So again, the arrival point is looking out over the village green. The first point of call is the ability to wait in a family lounge, which also has views through to a staff station at the hub of each 16-bed pod, 32 beds per ward, and then an ability to have multiple touch points for staff so that all patient rooms can have an ability for visibility directly outside their rooms, and potting each of these into an even distribution for nursing. So there's each pods of 4, pods of 8, pods of 16. And at the end of of each of the wings, we've looked at trying to integrate the idea of a winter garden, which is quite a Melbourne asset for places where it's a little bit unpredictable from a weather perspective. And so Jonathan's talked a little bit about the family, the role of the family in the design of the rooms, the central staff station to the inpatient units and the ability for staff to always be able to see the weather, always be able to see the patients and get visibility across to the winter garden. Because one of the things that we found in looking at a lot of facilities around the world is for all the best intents of winter gardens, they often had the doors closed, the doors locked in fact. So we really looked to try and design something that was safe, was all weather, so there was a breeze, but also could work not just as a space for people to go and sit and watch, but patients could come out there. It could become a place for meetings, a place for interview, a place to get some reprieve from being in the clinical environment. So if we've got a moment, we might try and get to a very quick video, which is really the where are we now, or where were we a couple of months back, which is just a minute long. See how this goes. I've got to press a button now, don't I? Thank you. Yeah, so this being, I think, in about April, so we've seen some trees grow since then. And a lot of furniture come into the facility. Solar panels on the top of the car park. Looking across to Victoria University across Footscray Road. Ballarat Road, I should say. So building A on the left, and straight ahead is building B, the main acute block. Okay. Heading through some clinical spaces. So this is actually the waiting area for the emergency department, able to be designed through pandemic, able to be separated off into different groups. Security beside us, mental health beside us. And it was a sudden ending. Thank you.